Hi, this is Dr. David Wade. I wanted to talk to you for a brief moment about neuropathy and talk to you about some of the treatment myths and see if we can't reveal some truths about how to take care of neuropathy. If you've ever wanted just to get some instant relief from your pain or associated with peripheral neuropathy, then this might be a very important message for you to pay attention to, because I'm going to show you how to get that relief and allow you to get your life back to normal again, to be able to walk on carpet again and with the bare feet, and regain your feeling in your fingers and toes, and start living a full, happy life without having to stop everything because of the pain. If you've ever had neuropathy, if you've ever been suffering with numbness in your hands or feet, if you've had a history of nerve damage, and there may be other indicators that this may not be as random as you might think, there's a lot of people that are out there in our community that are suffering from neuropathy. Peripheral neuropathy basically means the nerve is damaged. It's a nerve-related problem that affects many people, and it causes pain or loss of sensation. A lot of people are told by their doctor there's no cure, and they just put them on medication that keeps them numbing the pain, but it really doesn't effectively change the outcome of the problem. This report that I want to provide for you today is to be able to help pull the rug out from the treatments that don't work. So let's just talk a little bit about the background on neuropathy. What is neuropathy? Now, neuropathy basically means nerve damage. It's caused by different types of conditions. There's a number of them, like anything from metabolic problems like diabetes. Genetic factors play a role, infections, vitamin deficiencies. There's a whole host of other conditions, including spine, muscle, central cord problems, vascular difficulties. All of those things are contributing factors in many instances to the development of neuropathy. Because the nerves are used by the brain to communicate from the brain to the body. I mean, you got nerves that run from here down to here, and if those messages are disturbed or interfered with in any way, you're going to end up with potential to have damage in those nerves. It's going to have an effect on that part of the body where the nerve is damaged. So joints, muscles, internal organs, the skin, any combination of these areas of the body can be impacted by the nerve not functioning properly. So any damage to the nerve can result in a whole variety of different types of symptoms and related illnesses. Neuropathy can affect any of the nerves throughout the entire body, but it usually refers to nerve damage that affects the spine or the brain directly, not directly, but indirectly through the distribution network of the nerves, most of the time in the feet or the hands. So let's talk about one of the causes of neuropathy. Diabetes is one of the more common causes, particularly in this area. There's a lot of people that suffer with diabetes in this region, and diabetes is a particularly concern because it's related to metabolic issues, stress-related type problems. Although it can affect any of the nerves in the body, diabetic neuropathy usually affects the hands and feet most severely. Diabetes is a common condition that's reached almost epidemic proportions, and it results from the body's inability to properly digest and process glucose, known as blood sugar. So the blood sugar elevates, and the insulin production by the pancreas isn't doing its job adequately, and then with the blood sugar out of balance in the bloodstream, it can negatively impact the metabolism of the tissues, and it can affect the distal portions in the circulation down into your legs and feet. So diabetic neuropathy is one of the most common serious complications of diabetes, but it's easily prevented. It's easy to slow down the progression without, but it's hard without proper nutrition, a healthy lifestyle. It's hard to get it under control without neurological stress reduction, and your body has to have the ability to control and regulate insulin naturally through the messages from your brain to your body. So we have special treatments that are designed to be able to reintegrate the information so that the brain does get the messages properly back to the body. Now, the challenge that we've seen is there's a lot of diabetics that have been told they have diabetic neuropathy and that there's no cure for that. However, we've been able to help a number of people with diabetic-related problems and the neuropathy. So sometimes the neuropathy is not directly related to the diabetes, but it's a complication from other associated conditions. There's a number of other causes like toxicity from alcoholism, exposure to different types of toxins and chemicals and other types of poisons. Infections can create neuropathy, genetic disorders, tumors that surround the nerves, or trauma from the nerve from some kind of accident in the past. There's a lot of people in our society that have been exposed to automobile accidents over the years, and the accumulation of damage that results from an improperly healed trauma can lead to things like neuropathy, disc pressure on the nerve, extended pressure on the nerve from what's called stenosis, where the bone begins to narrow down around the joint, repetitive movements, things like carpal tunnel and repetitive stress disorders. Those types of things can cause neuropathy type problems. Also, autoimmune disorders like rheumatoid arthritis and lupus, they can be related to neuropathy. So as you can see, neuropathy is somewhat of a complicated animal, and if you don't really understand the source of the neuropathy, you can easily just say, well, we can't fix it, we're just going to have to give you this medication. So neuropathy has a lot of side effects. Can you imagine taking a pen and sticking it into the bottom of your foot, or constantly jabbing your foot so that it stays irritated, it wakes you up at night, makes your legs real restless, or your fingers where they're constantly tingling and numb? Well, those types of problems sometimes start out generally mild in the beginning in the hands and feet, but it can progress to the point where